Right, guys. Looks like we're going to go ahead and get started. If anyone else comes in, I'll just go ahead and admit them. So we have our great guest today, Anika Suarez. And today, everyone, we're going to do our lunch and learn session for this month of August. My name is Al Williams. I'm the public relations liaison here at Capital Area Healthy Start. And we're just going to go over some quick housekeeping rules. We will save our questions to the very end of the PowerPoint. It will last around 45 minutes. Then we'll have a 15-minute Q&A. And then we'll move on from there. So today we're going to dive into the critical topic of proper nutrition for healthy eating habits for infants and toddlers. Establish the practices of the critical growth in the development of parents and the playing the visual role for this process. In the United States, approximately 84% of infants are breastfed at one point, receiving essential nutrients and antibodies necessary for their early development. However, by the age of 6 months, the rate drops down to around 58%. And then another 6 months after that, the rate drops down to 35% of infants are being breastfed throughout that month. Feeding difficulties are very common when it comes around to the development of different children. We want to make sure that here at Healthy Start, we're able to pass off that knowledge to make sure that every baby has the proper nutrition. And that is where Miss Anika comes in. She's been with Florida State, proud alumni, deep passion for helping infants and children. Since graduating, she's dedicated herself on staying on top of the latest techniques and developing her skill sets to providing and feeding therapeutic lactation support for infants and their families. She's the owner of Sunny Pediatric Services, a team full of speech, occupational, and physical therapists, as well as lactation consultants. Anika strives to help as far as many infants and young children in the Tallahassee and Crawfordville area as possible. Please join me in welcoming Miss Anika Suarez.
Great. Thank you so
And the
much.
floor is yours.
All right. Great. So I'm here today to talk to you all about encouraging appropriate mouth and feeding development. Also to go over some of the recognizing some feeding difficulties in an infant or child and when therapy may be warranted. So as Al described, this is about me. This slide is about me. I am a speech language pathologist, and I'm also a lactation consultant, owner of Sunny Pediatric Services, and I'm the mother of children who also had feeding difficulties as well. About this presentation, I wanted to first say that this is it's information-based. This presentation, the talk is evidence-based, and this is best practice for feeding and mouth development. So the intention is not to make any parent feel guilty about what they didn't know regarding their child's feeding practices early on. I know as a parent, you can kind of, when you learn some of these things later, you're like, oh, why did I do that? But you can't feel guilty about anything you didn't know previously. So I'm not trying to, make anybody feel bad about things that they hadn't done before with their child. And then also what the good note is that therapy can always remediate any poor oral habits that a baby may have in the future too. So if we work with them as infants in infancy, it's a lot easier and a lot quicker of a process than as we get older. However, all of these things can be remediated and changes of habits can happen later on too. So I first wanted to describe a couple really important things about development. The biggest thing that I can say is the most important with your baby is putting them on their tummies. We don't get a lot of babies don't get time on their tummies when they're awake. We do a lot of education on back to sleep, but there's not a lot of education on tummy to play. And it's super important for so many different reasons to put babies on their tummies. So we've got a nice visual here of helps with sensory integration, helps with their neck control, helps with posture and strength, hip development, all kinds of things. Also helps with gas, constipation. So putting babies on their tummies is wonderful. And we want to try to do that as much as possible when baby is awake. Another thing I was going to show this slide for is a little bit about what the mechanism looks like in the mouth, so we can kind of understand the differences between breastfeeding and bottle feeding. So we have in the mouth, we have our nasal passage up here. We have our palate, so the roof of the mouth, which is also called the palate, and we have our tongue here. In a baby's mouth, everything is very narrow and squished together. In an adult's mouth, or as children grow, they start to elongate and get a little bit more spread out. So we also have here, this is the soft palate. When a baby sucks, they have to elevate their tongue up to the hard palate, and it acts like a squirty fish in the water, where if you squeeze just a little bit and you go under the water and you let it go, you're not going to get as much water to fill the fish as you would if you were to squeeze all the way down and go into the water. So if you were pretending like the top of the squirty fish was the palate and the bottom was the tongue, then we really need to have a good lift of the tongue all the way to the palate so we can get that good pressure. So then when we let go, that milk can be extracted. So that's where some issues may come into play when we have difficulty lifting they have difficulty lifting their tongue, or they have a high palate. So you may have heard of those kinds of things impacting eating. So I wanted to show you a good model of what that looks like inside when we're talking about the palate and the tongue. Another thing I wanted to bring up as well is I want to show the difference between breast and bottle feeding as far as how it helps with palate shaping. So breastfeeding is, as you can see, with an appropriate latch. We've got the chin that comes in, and the breast goes all the way back to this soft palate. So in here, that's as far back as that breast tissue goes. Now, breast tissue is very malleable, and so that helps shape the baby's palate. So if we have a high palate, a lot of times that breastfeeding can help, just breastfeeding alone can help with that shaping of that palate. And this is also why we say that breastfeeding can continue past a year, because there's not pressure on the palate like there is with a bottle nipple, and it's not pushing up against the front teeth like a bottle nipple would do. So breastfeeding can continue past a year, and it's actually great for palate shaping, and really good for movements that babies need to make with their mouths for feeding. These are just some examples of some breastfeeding positions. Any position works as long as the mother is comfortable and the breastfeeding parent is comfortable, or the baby is comfortable. So there are some positions that some babies may do better in, but as long as both parties are comfortable, that's a good position for baby to be in. Now, as a bottle feeding, a little different than breastfeeding. As you can see, the bottle nipple usually comes into about right here, halfway through up to the palate. Now, the bottle nipple is firm, even though we have some bottles that are a little softer, they're still not as malleable and as soft as breast tissue. So that bottle nipple sometimes can push up against the palate, and it can also push up against dentition too. So that's why we suggest that bottle feeding is discontinued at a year old. But we'll go into that a little bit further. I want to also touch base on some bottles. There's a lot of different bottles on the market. There's wide neck, there's angle neck, the standard ones, the disposable liner ones. The ones that have actually the most research behind them and do work very well are the vented bottles. So like the Dr. Brown's here, this one is a good bottle. And what that venting system does is it just redistributes bubbles to the end of the air bubbles to the end of the bottle. So it doesn't go into the baby's mouth. There's also different nipples. The traditional nipples we have that, go into the mouth, a lot of them do encourage suction, which is really good because we want babies to be able to suck well. Some of them encourage a little bit more compression, like squishing it. But we really want something that is going to help with tongue movements and not hinder that pushing up on the palate or encourage that pushing up on the palate. So some bottles, the nipples like these orthodontic ones, if you can see how they're shaped, they do push up on the palate. So I'm not a big fan of these. And really any bottle that is used past a year is not going to be orthodontic because it's going to push towards the teeth and up on the palate and encourage a sucking pattern that we really want to disappear by the time they're a year. Well before it, but definitely by the time they're a year. And then they have some breast-shaped ones. Now, the only problem with some of these breast-shaped ones is that the baby ends up sucking on the nipple, like the very edge of the nipple, and they can't get their mouth really far onto it. So even though it looks like a breast, it doesn't operate the same way. So they're not able to pull that whole bottle nipple into the mouth all the way back to the soft palate like they are with breastfeeding. So these breast-shaped ones, I actually am not a fan of as well because of it encouraging them to just be on the little edge of the nipple right there. Okay, so these are the bottles. Bottles are never going to be the breast. As much as manufacturers try to make them the same, they are never going to be a breast. So these are the ones that do encourage the most appropriate sucking and the most appropriate tongue movements if you're going to use a bottle for a baby. So these Dr. Brown's ones are great because they are vented and they do encourage more suction. And then the Lancino, and this one's called the Gula Cola bottle. And that one also is a little bit more, it's a little softer, it goes further in the mouth, doesn't push as high on the palate, and it's a better bottle than some of the other ones that are out there. So pacifier usage, I do like pacifiers, even though yes, it does push up a little bit on the palate, as long as we are using them before a year. I do actually suggest weaning from the pacifier around 10 months would be ideal. With pacifier usage, we also want to encourage as much of that appropriate tongue movement as possible. So with these pacifiers over here, we actually encourage tongue cupping, which is necessary for when we start solids, or eating and drinking for later in life, and very important. So I do like these for that reason. This one is called the Ninny, and it's very soft, like breast tissue actually, so it doesn't push up on the palate, and it does encourage suction to keep it in. Now these pacifiers again push on the palate and don't encourage good sucking. So and this one encourages a lot of chomping because it's very flat. So out of all the pacifiers, because I know whenever you are pregnant and have a baby shower, everybody's buying a bunch of pacifiers, or even any of those gifts bags that you get all kinds of pacifiers, and you're like, I have no idea which one to use. I prefer these would be the best ones from an oral motor speech perspective. These are going to be the best pacifiers to use. So another thing I want to talk about too is chewing toys and teethers. So teethers are great for when their babies are teething. However, not all babies teethe at 4 months, which a lot of times we think that they're teething because they're putting their hands in their mouth a lot, but that's developmentally appropriate for 4-month-old. So what I suggest for 4-month-olds, starting around 4 months, and they can be used all the way till, they're through toddlerhood if they want to with these, is chewing toys versus teething toys. So teething toys are ones that you're going to bite in the front because the teeth come in from the front. So that's usually what a lot of those teething toys are. And, you could still keep using these for babies that are teething. They're great for that. But ones that I want to encourage babies to start using are the ones that have like a stick shape on it, on the end there. So that way we can get it back on the side and we can work on chewing, because that's how we eat our food. We take a bite from the front and then we move our tongue to the side and we chew, and then we gather it up and then we throw it back to swallow it. So we really want to encourage chewing, and this is going to help with jaw strength, stability, chewing food later on. So it's a really developmentally appropriate mouthing toy to use. So any of these stick shaped ones, they also have one that I didn't put on here, the one with like the little panda bear that has the little arms sticking out, and that has like a little stick, so they can get that back there. So any of those are great for working on that chewing in the back, because we chew our food in the back. We don't chew our food in the front. We bite in the front. All right. I know I'm kind of breezing through all of these recommended things in the beginning, so we can definitely have questions at the end for these. Utensils that are recommended. So these are the best utensils to use for babies and for toddlers. So for babies, we really want shorter spoons that they can control and they can put to their mouth easily. And then for toddlers, same thing as well, but we can make them a little bit long. So we can start getting a little bit longer, but we want to try to get rounder or a little bit heavier handles for them. I always want to encourage self-feeding. That's super important for life in general. So whenever we're starting babies on solids, encouraging doing kind of a combination of parents feeding and baby feeding themselves is great. It's a great combination. And these are really good spoons that will encourage that and will be easy for baby to pick up, rather than just a regular like metal spoon or those old-fashioned baby spoons that are so long and babies like all over the place with them. These are a little bit easier for them to control and put it to their mouths. All right, and then the last thing as far as utensils or things, feeding things that goes, is seating. So this is also very essential, very, very important and essential for when babies start solids. So American Academy of Pediatrics recommends starting solids at 6 months. They are developmentally ready at 6 months. When we start babies too soon, like around 4 months, that's when they still have that suck reflex. And so a lot of times they're not really successful with feeding. They also don't have a lot of trunk and core stability when they're 4 months. So they start to get that around 6 months. And we really want babies to be able to sit supported before we're starting solids. We also, again, speaking of supported, we want to make sure that these chairs are supportive of them. So being able to sit upright, we don't want to lean them back because that opens up our airway. So we don't want to do that. We want them to sit upright and we want to have them supported. So even if baby's kind of has a hard time with head control and they can't hold their head up, or they're slouching a whole bunch, sometimes even as simple as just putting some little rolled up towels next to them can help. And then we also want to make sure their feet are supported too. It's like if you go to a bar and sit at the bar stools and there's no foot support and it feels really awkward to eat and you're just constantly trying to find a spot to put your feet. Babies are the same way. We need our feet to be firmly planted to eat. So feet dangling, it's harder to eat. And if they're having to work on their core control and they're having to work on finding stability with their feet, they're not going to be able to manipulate their mouth very well to eat the food that they need. So these are some good chairs that are high, that have a nice flat back. I do always recommend a tray so we can have exploration of foods. And then if they have a footrest that's really low, so like all of these, most of them are very low and baby's feet are not reaching them yet, then you can put like a boxes or like a textbook or a yoga block or something on that footrest to just raise it up a little bit so baby can rest their feet. Okay. So when I talk about purees, these are what I'm talking about. Um, these are some good early solids for babies. So when we're starting at 6 months, mashed foods are great. These purees are great. Even some of those like arrowroot cookies are great too. They can kind of start dissolving easily in their mouth. Anything that's going to dissolve really easily is going to be a good one. When we start getting a little bit bigger, so like 7 months to 8 months, we can start introducing things like soft strips, soft cheeses. We've got, like these really soft fruits. And this one just has like a little bit of texture in it. So it's like mashed, it's like beans, but has a little bit of like the texture of beans. And then when we get a little bit older too, as we get older and when we're closer to 12 months, I would say that 10 months, around 9-10 months, all the way to, of course, into toddlerhood, we should be able to eat these types of foods. So a little softer, but still has something to chew. I wouldn't start with something being small like this as a 6-month-old, because we might have more gagging and things like that too. I have at the end too some resources, and Solid Starts is an excellent resource. It's evidence-based and it's a website that's free, and you can type in any food in the search bar and it'll come up with how to present it for a child, depending on their age. So it's a really great website. And so if you have any questions about that too, that's a great website to look at. Oh, and then there is one more thing I wanted to talk as far as like utensils and things to use. So cups, we really want to encourage straw drinking and open cup drinking as early as possible. So around 6 months, that's when I start to introduce straw drinking and open cup drinking. Sippy cups are not developmentally appropriate. They were made to make parents' lives easier because they didn't spill a long time ago. And then people have used that pattern, or that the shape of the sippy cup for years to just continue manufacturing cups. But what it does is it actually encourages the child to bite and then suck. So it's that, along with the 360 cup, which is also very odd to drink out of if you've ever tried to drink out of one of those. They have to bite on the edge and then suck. So again, if your child has this cup and they are doing fine and they're not having any difficulties with speech or difficulties with feeding or any of these, it's totally fine. You're not going to harm your child by using these cups. It's just these are the most appropriate to encourage the most appropriate mouth development. And so if we have children that do have a history of feeding difficulties, we want to go ahead and just skip the sippy cup completely, because it's not going to teach them any functional skill that they need later on in life, because we're not walking around as adults drinking out of sippy cups. So we want to drink out of straw cups or open cups. So these are some good early straw cups and good early open cups to teach your baby to drink from a straw or an open cup. All right, so now I'm going to get into feeding development. So I separated it to 0 to 4 months, 5 to 6 months, 7 to 9, and then 10 to 12 months. Okay, so babies should be only fed breast milk or formula, from the breast or the bottle between 0 to 4 months. So we definitely do not start solids before this time. They have a suckle pattern. Also, we do not want to give water at this young of an age too. If you were to give the spoon, they would give a suckle pattern. And that's why we don't want to give spoons, or we don't want to start feeding solids right now. They can begin playing with puree in the high chair around 4 months if you want, but also just, FYI, as a parent, once you start solids, it is very messy. It's exciting to start, especially when it's your first child. But waiting until they're developmentally ready to then start feeding themselves and you start feeding them is definitely preferred, is definitely ideal. So we can, when babies are born, they should be able to crawl to the breast. or be able to open up their mouth for the breast or bottle. They want by 1 month, they should easily be able to locate the nipple, the bottle nipple or the breast. 2 months, sucking should become a little bit longer. They're able to drain the breast or the bottle. 3 months, they should be able to recognize that the breast, recognize the breast or the bottle and get excited about it. And then at 4 months, they start to be able to hold the bottle or the breast with their hands. And they can easily find things, they can easily find it, latch on, no issues, no supports or anything. And then 5 to 6 months, that's when food's introduced around 6 months. I say around because some babies do have a good stability at 5 months and may be ready for it, may show signs of readiness, like looking at the parents while they're eating or the caregivers while eating. And then majority of the nutrition still comes from breast milk and formula. So that lasts all the way until they are 12 months. So we still have majority of their nutrition is breast milk and formula. Anytime we're introducing solids, this is for fun, it's for exploration, it's for learning skills of how to eat. So we want to always think about it as quality versus quantity. So if your 6-month-old just starts eating solids and they don't finish a jar of baby food, that is totally fine. That is not a serving size for a 6-month-old. Those jars are actually a way over proportion sizes. So at 6 months, again, we're just playing with it. Baby shows any signs of distress or not liking it, you say, okay, we'll do something another time. We'll try it again later. And you pull them out. We don't ever want to start pressuring babies to eat because that can kind of turn to go the opposite direction. So some foods to introduce are like purees. Some families want to introduce baby cereal as well. Well mashed foods, soft baby cookie or like dissolvable. They have these little pick-me sticks that are great that dissolve easily. Babies should be able to, again, hold the bottle or the breast, putting their hands at on both sides of the breast. And then they should be able to start clearing food off of the spoon and be able to not have like a suckle while they're doing it, and should be able to put the spoon up to their mouths as well. Now, it might be messy, might be all over the place, but they can start working on that hand to mouth. 7 to 9 months, they should be able to eat like chopped, cooked fruits and vegetables, soft cheeses. If you want to do something like baby-led weaning, I usually recommend starting at around 7 months, where we've got strips of foods and soft foods. Again, that Solid Starts website is wonderful for that. And it can guide you on what is appropriate to give them. And they can self-feed, they can close their lips to swallow when they swallow, and they can hold mouth and bang the spoon. So they can hold and control the spoon a lot easier too when they're 9 months. All right, 10 to 12 months. So weaning from the pacifier, I put and bottle and pacifier can start around this time. Breastfeeding can definitely continue. The bottle, it's the starting the weaning process, not saying that they're still not getting their primary source of nutrition from the bottle, but if they can start taking things more, like if they can start taking formula more from a straw or an open cup, and we're starting to move from having a mostly liquid diet to a more solid diet, the closer we get to 12 months, because when we are 12 months, we want to have that gradual switch to, okay, they're not drinking as much formula or breast milk. They're having most of their nutrition from solids. Now, again, breastfeeding can continue throughout this whole process and after. And then baby should be honestly able to eat pretty much everything. So we do, of course, under 12 months, we want to make sure we're not giving honey or anything too. But they can eat. And also with eggs, there's actually mixed research on it. Now we're starting to show that they can eat eggs a lot sooner than 10 months. But previously it was thought to introduce it at 10 to 12 months. So that's why I have this one in here. And then we've got, they should be able to chew on the back molars. They should be able to feed themselves, and they have a coordinated pattern, should not be dropping a lot of food out of their mouth. And they should be able to manage their saliva as well. Okay, and then drinking, again, I mentioned before, sippy cups do not encourage appropriate mouth development. So again, if you've used them before, it's not the end of the world. I know I grew up drinking out of a sippy cup, but it's just, now that you know, if you are able to switch to straw cups or open cups, that would be preferred and ideal for mouth development in the future. So again, those first cups that I had there too, like a cup with a recessed lid. So like a Starbucks cup, how they kind of have a recessed, the lid kind of comes down a little bit. Open cups with assistance, because if you're giving it to a baby, they're going to pour it out and make a mess with it. And then straw cups as well. So 4 to 5 months, they can take a sip from an open cup held by an adult. At 6 months, they should be able to drink from a squeezable straw. So that's this Honey Bear that's here. I'm sure a lot of people have heard about this Honey Bear. And you can squeeze it, and then the liquid comes out through the straw part. And then they can drink from an open cup and a straw cup with minimal spillage when they are, drink from an open cup with wide jaw movement. So they're kind of doing that number at 7 months, but drink from a straw cup with minimal spillage by 7 months. And then they can take multiple sucks in a row at 8 months, and then it just keeps getting better and better. They should be able to progress to that and be able to drink out of a straw, no problem, or an open cup at 12 months. Okay, so I'm going to briefly go over just recognizing some feeding difficulties. If you ever suspect any feeding difficulties, this is a wonderful questionnaire online. It's just questionnaire.feedingmatters.org. I think I put it, .org. And if you also have any questions too, you're more than welcome to email me. Now, we are just starting a Intro to Solids class. I actually did not put this on here, but we do have an Intro to Solids class that we offer once a month, the first Friday of the month, in our office. And we will have an SLP that specializes in feeding. And you can get any of your questions answered there, and also get hands-on practice of what's going, what to give your baby to eat, and how they should be doing this, and how they should be eating, what it should be progressing to. And then what's great about having an SLP watching your baby eat is that we can recognize if there's any feeding difficulties that need to be addressed with therapy. Okay, so recognizing feeding difficulties at 0 to 4 months, of course, so this is coughing and choking while feeding. Is going to be on every slide, because that is not typical. We should not cough and choke while we're eating. Now, a cough here and there is okay. Choking clearly is not normal, not typical. But we do not want this frequent. Like every time they eat, they cough. That's not good. Reflux, excessive gas, or baby colic could signal feeding difficulties because of air swallowing. Spitting up or vomiting during most feedings, weight loss, or not gaining weight appropriately, like dropping percentiles but still gaining, maybe kind of a red flag for some feeding difficulties. Maternal pain or parental pain while nursing, seem unsatisfied or cranky after feedings, like they just keep wanting to eat more and more. They don't take a bottle or nurse when offered. They arch or turn away when introducing the bottle or breast, and they fall asleep before the ending of the feeding. So those are some red flags for feeding difficulties for infants under 4 months. Same kind of continues with the 5 to 6 months, similar to those other ones. and I added on for this one is wanting to eat more than every 2 hours. So if they're eating like, every 2 hours is fine, but if they're eating like every 1.5 or, and all through the night, every 2 hours at 5 to 6 months, that's not typical. We really expect them to eat about every 3 hours when they're this age. 7 to 9 months, we include some of the other ones, but if they're not enjoying, so this is more for like the solids though, if they're not enjoying food or they don't want food, not to say if they don't want to eat a lot of food, because again, we're going for quality, not quantity. But it's every time I put them in the high chair, they scream, or whenever I introduce something, they just push it away and they don't like it. Or they cry every time we're trying to feed them or helping them, or they don't like to touch the food on their hands or things like that. Those may be some signs that we may need to seek therapy, potentially occupational therapy, to look at those sensory needs during feeding. And also, of course, not gaining weight appropriately, and then also can't drink through a straw, especially if you've introduced it at 6 months. Now, if you've introduced it not till 7 to 9 months, then, it may take them a little bit of time to learn, but most babies pick it up pretty quickly, especially at this age. If you just introduced it at this age, they'll pick it up pretty quickly, like within like a few minutes, quickly, or if not a day or two. And then wanting to eat more frequently than every 2 hours. And then for 10 to 12 months, so all the same ones kind of before too, but they also cannot drink out of a straw or a food pouch without coughing or choking or excessive spillage. And because a food pouch is a straw essentially. Now, we don't want to encourage them to drink their food all the time and encourage them to drink from a pouch. However, it is a great tool to have. It is a great thing to have, that when you're out and on the go and, just hand them a pouch and things like that, they're great for that. And if they can't drink out of that, that might be a sign that they may have some difficulty with feeding. Likely, if it's just that, that probably isn't just the only thing that they're having difficulty with. And then there's drinking from an open mouth cup. That would be if they have difficulty with that too. Not chewing their food or not swallowing all the food, like if they're pocketing food in the cheeks. That's a red flag for some feeding difficulties. And then also not accepting new foods too, like just eats chicken nuggets or just eats mac and cheese or just eats one food. We really shouldn't see that at this age. They should be able to go between different foods and enjoy foods. And yes, there's some foods that they may not like, but it should be a very, very, very small list of foods that they don't like. Okay, so if you recognize feeding difficulties, of course, tell your child's primary care doctor. That's important to tell them. And then if you want to complete the questionnaire on this website, that's a great questionnaire that can tell you like, hey, these are signs of feeding difficulties. And then if for breastfeeding infants, contacting an IBCLC is great. I'm also IBCLC as well as a speech language pathologist, so it does help that I have both sides of both things, so we can work on the therapy part of things as well. And then contacting a speech language pathologist or occupational therapist who specializes in feeding disorders. Again, our office provides that for the community. And then these are some good resources. If you like to read the book, Nobody Ever Told Me or My Mother That, is a wonderful book. It was written by an SLP and it's like this thick, but it has checklists and it has all different things about appropriate mouth development and feeding development and everything great that not many people know because nobody ever told them that. And then this is also a really good one for kind of starting solids. It's a good book. again, that Solid Starts website is also excellent. I actually don't have that on here. I realized I didn't put that one on there. Yeah, and then like I said, I have we have Intro to Solids classes on the first Friday of every month at 9 o'clock. All right. So now I am available for any questions that anybody may have.
Thank you, ma'am. And we will open the floor up for any questions.
I see the question of the PowerPoint. Yes, I can send this. Can I just send this to you, Al? And then you
Yes, ma'am.
just, okay, I'll send that. And then, yeah, I'll have that.
Yeah, I can send it out to everyone.
Awesome. I know. I just covered a lot of info very, very quickly. So.
This is Jessica. I had a question. Great information. Thank you so much, Ms. Suarez. So my daughter's a little bit older. She's at 20 months now. She goes back and forth between the sippy cup and the open cup, but I will try to focus more on the open cup and the straw. For utensils, I notice she tends to do the spoon more than the fork, and I, try to have both, and then sometimes she just drops both and eats with her hands. So I want to be able to work more on that. Are there any tips or
Yeah.
suggestions?
So, I mean, really, that's very typical for that age. They really want to use their hands, and it's actually a good thing when they want to use when they use their hands, because they're okay with the texture and the touching it and everything. So I would just say the biggest thing with the utensil usage is just reminding her to use her spoon. Use your spoon. Use your spoon. Just continuing to say it. That way it kind of gets ingrained in her head that every time, oh, I'm gonna hear use your spoon every time. Now forks too, they're good, but at this age too, spoon is fine if they want to continue to, if she prefers the spoon, that's okay.
Okay, thank you.
Yeah.
I have a quick question.
Mhm.
So my daughter basically only eats pouches and chicken nuggets. She's 21 months old.
Okay.
And we kind of followed these guidelines and stuff, and she bounces back and forth. Al's smiling because I talk about this all the time, but what should I do? How can I help her introduce more foods? She won't even put it to her lips to try it.
Okay. So in that case, you said 21 months. Okay. Yeah. So in that case, I would recommend possibly getting an evaluation by an occupational therapist, just because there might be a sensory component, and that may be why she's not liking that. Now, it doesn't hurt to get an evaluation and then them tell you, oh, she's just being picky, or like we're just, but they can also give you some tips on like things as well, of what to try. So, but I would say that just for now too, maybe introducing, do you guys typically eat at the table together? Okay.
We do, and she's got a high chair with her tray, and she loved sitting in it for the longest time, and now I don't know if it's like that almost 2-year-old toddler thing, or like now she's just like not loving it. So we're trying to follow all those things. I just can't take
Right.
a beat.
Yeah. So I would say an evaluation would be helpful, but another thing you could also try is like introducing food in a not intimidating way, if that makes sense. Like if she's not liking that chair, maybe doing like putting like a shower curtain on the, like a shower curtain liner on the floor, and letting her just like play with like some steamed vegetables, or playing with some things, and just like making a forest with them, and not pressuring any eating it to start, and just having her play with them. And then you could even have like a baby doll, and the baby doll eats them. Maybe she kisses the food. So things like that, where we're not trying to pressure, because as soon as kids, and especially toddlers, start to feel pressured, then they're like, no, we're not doing that. So trying to maybe make it in the meantime as like a lower pressure situation and just playing with food, because I know that can be stressful as a parent when you're just like, okay, you need to eat because you need calories. So you're going to eat, you have to eat this. So I would say if you just try those more playful things, and maybe asking her to kiss the food versus taste it or take a bite. Kissing it is a little bit less like it kind of takes their mind off of, oh, I have to eat this. It's more of like, I'm just playing, I'm kissing it, kind of thing.
Perfect.
you
She's
can
in
try-
her kissing era, so that would be a good start.
Okay, well then perfect. Then she probably would like that. And so I would also think about foods too that are maybe not going to leave residue on her lips too. So something like a carrot would be good because that's not going to leave anything on her lips. We wouldn't want something that's going to be like juicy that's going to leave it on her lips, because then she might not like that part of it. You could of course work up to that, but things like trying to just make it more like a fun, playful experience and doing it somewhere different than the table if she's averse to the high chair.
Okay, perfect. Thank you so much.
Of course.
You're on mute, Al. Sorry.
There we go. Better. Thank you. Our next Lunch and Learn will actually be on September 13th and not on our normal date of September 2nd due to the holiday coming up. And our next Lunch and Learn will actually be on parental self-care. We do a lot speaking directly to children and toddlers and babies. We do want to make sure that we have our mothers have the right headspace for growing and nurturing that baby as well. So we'll definitely be doing on parental self-care, and we'll be sending out those links for the next Lunch and Learn coming up on Friday. So we definitely want to thank you guys for tuning in, and thank you, Ms. Suarez. Great presentation. We definitely love the pictures inside of that presentation as well. Very visual. And we want to thank everyone for tuning in this Friday, and enjoy your rest of your lunch and have a great weekend.
Thank you. Have a great
All right,
weekend.
bye-bye, guys. Adios.
Thank you, Ms. Suarez.